It's my pleasure to welcome, whoa, that's loud. It's my pleasure to welcome Dr. Delia Grace Randolph, who will be giving us a presentation about food systems, food safety, and health. We're really happy to welcome everyone who's joining us here in person today. Thank you for coming. And those who are watching virtually from across the country, welcome to you as well. My name is Kate Dewey, and I'm the director of the One Health Institute and the associate vice president academic at the University of Guelph. After Dr. Grace Randolph's lecture, we'll hold a little discussion, she and I, and after that there will be a question period. To ask a question from the audience, if you could put your hand up and somebody will bring you a microphone. We'll also take questions from those who are listening virtually, and you can put your questions in the chat. And following the question period, there'll be a light lunch served here, and you're more than welcome to stay for that. Before we begin, I would like to acknowledge that the University of Guelph resides on the ancestral lands of the Attawandaron people and the treaty lands and territory of the Mississaugas of the Credit. Today, these gathering places are home to many First Nations, Métis, and Inuit peoples, and we offer our respect to them as our Indigenous neighbors. Acknowledging them reminds us of our important connection to their ancestors and to these lands where we work and learn. And now it's my great pleasure to introduce Dr. Delia Grace Randolph, who is this year's awardee of the Arrell Global Food Innovation Award from the Arrell Food Institute at the University of Guelph. Dr. Grace Randolph is a professor of food safety systems at the University of Greenwich, UK, and jointly appointed as a scientist at the International Livestock Research Institute in Nairobi, Kenya. Delia is an epidemiologist and a veterinarian who graduated from the National University of Ireland. After spending 5 years in private large animal veterinary practice and 3 years as a volunteer in Bangladesh, she completed a Master's of Science at the University of Edinburgh and a PhD at the Free University Berlin in Germany. Her postdoctoral position was at Cornell University and the International Livestock Research Institute, focusing on food safety. From 2006 to 2020, she worked at the International Livestock Research Institute on One Health and EcoHealth projects at the intersection of the health of the environment, animals, and people. I had the pleasure of meeting Delia in Kenya, and we worked together to mentor Dr. Natalie Carter during her PhD. Delia has lived and worked in Asia, West Africa, East Africa, and authored or co-authored more than 200 peer-reviewed publications, as well as training courses, briefs, films, articles, chapters, and blog posts. And she co-authored the first and only book on food safety in informal markets. Please help me to welcome Dr. Delia Grace Randolph.
Good morning, everyone, and it's a great pleasure to be here with you today in Guelph. I was delighted to be here, coming down from Toronto after receiving the Arrell Award, and on Food Safety Day, of all days, it must have been a very appropriate time to receive an award focusing on some of the work myself, my colleagues at NRI, ILRI, and colleagues from Guelph have been doing in low and middle income countries on One Health more generally, but especially on food safety. So this morning, I'm going to talk to you a little bit about the research and some of the key findings, but also starting off with how I got to that research and the journey to here, and then we'll have some time for some discussions and questions. So, from farm to fork in 5 chapters. I started off growing up in the northernmost part of the westernmost island in Europe, up in County Antrim in the northeast corner of Ireland, That cliff you see, the second highest cliff in Ireland, was about a quarter of a mile from my house. And in the community I lived in, there was the highest density of sheep in Europe. It was a small rural community in a very beautiful place, actually like Halifax, where I'll be going later in the year, and some of you will be too, to ISVI. Canada is hosting one of the biggest veterinary epidemiology conferences this year in Halifax. And if you've ever been on the Atlantic coast of Canada, the coast of Ireland is very like that. But also growing up in a small rural community of farmers was a very good preparation to my research career in low and middle income countries, because farmers are the same the world over, whether they're in Ireland or in India or in Mozambique. Yes, I think, that they are a community and very good people to be with and work with. So the second chapter was when after I graduated as a veterinarian from the National University of Ireland. Like many of my forefathers and mothers before me, there wasn't work in Ireland. So in fact, 2/3 of our class headed off to England, Australia, America to seek for employment. We're now in a world where many people are on the move and have been on the move because opportunities, and there are some places with lots of people and not so much work, and others with lots of work and not so many people, and all of the stresses, the opportunities, the problems that entails. So I went to work in Lancashire in a large animal practice. I'd come from sheep, and I was now in the land of dairy cattle. And I spent 5 years there and enjoyed it very much. And I think I also learned 2 great things from those 5 years in private practice. The first is the importance of clients. You know, the client is the customer is king, and you learn a lot about relating to people and client services in business, which veterinary is. Private veterinary services are a business, which you never, I regret to say, learn working from the government or working in academia to the same extent. So yes, the importance of client services, and then the importance of the bottom line, the importance of profits, which sounds, again, I've been working for much of my life in development and in NGOs and in academia, but when it comes to working with farmers in the real world, things have to make sense. And we had a very interesting comment from somebody working in farms in Canada at the Arrell Summit, which I had the privilege to attend. And he was saying, well, sustainability is great, but if it doesn't pay, I'm not going to do it. And that is the reality many of the farmers, vendors, people we work with in low and middle income countries face. We want equity, we want sustainability, we want animal welfare, but in order to get there, we have to make sure that things are financially viable. The incentives are in place, the motivations are in place for people to change their behavior. So chapter 3, well, what happened at the end of these 5 very pleasant years in large animal practice in Lancashire? I was offered a partnership in the vet practice, which was a kind of a rite of passage. If you stuck around for long enough and did a good enough job, you usually, in those days, it was before the time of the big, the franchises, which are now sort of taking over the veterinary profession, the veterinary landscape in the UK. This was still the time of small independent practices. And generally, after 5 or 10 years, you would be offered a partnership, and I was. And as I said, I really liked the place and the people and the cattle. And I thought, if I accept this partnership, I'm going to be here for the next 40 years. And that's going to be the end of my life. And at the time, I had never been beyond a package holiday to the south of France, so I knew nothing of Europe, let alone the rest of the world. So I said, thank you, but no thank you. And I went off to Bangladesh to work as a volunteer for $90 a month and keep yourself. And I did that for 3 years, and it was a very, very interesting experience. There was one thing, I wonder, do I have any colleagues here from Bangladesh? Because I must say it was not the easiest of places to start, especially as a woman. It was a very hierarchical, patriarchal society. And one of the things which sometimes volunteers used to tell each other is the good thing about starting your work overseas in Bangladesh is nowhere you go is going to be as bad as this. Well, that wasn't completely true. And I must say, one of the nicest things which has happened to me is in the past 5 or 10 years, going back to Bangladesh as a scientist and a professor, and seeing places which were really struggling. I mean, 30 years ago, Bangladesh was one of the most poorest, and it had just come out of a civil war, one of the really worst performing countries in the world, and now it has come along. It is now approaching India, and going to places you can see that prosperity. Villages where I had been 25 years ago, and I would have been the tallest person in the village, and I'm not very tall, and you would see children running around with no clothes on at all, and mud huts and thatch roofs. Now these villages have got tin roofs, and the kids are all wearing clothes, and they're going to school, and pretty little girls will have a little gold chain around their neck. And yes, it's so nice to go back to and see with your own eyes that development can work. Sometimes it's easy to be cynical and think that, what are we doing? And there's so many things that can go wrong and do go wrong. But things can go right too, and things have gone right for Bangladesh, and let's hope that they go right for many other places. So after 3 years in Bangladesh, I think my takeaway message from there, and I'd gone there as a sort of a self-styled, a soi-disant expert to kind of tell people and help people, because there was me as a vet with my 5 years experience, and I realized that I knew almost nothing about development, and I didn't really know very much about how to help people or how to advise people. So I also got absolutely fascinated by the challenges and the problems and wanting to solve them, knowing that things could be done better and could be done different, and that I didn't really have the skills or much to offer. So instead of coming back and going back into practice, which had been my intention when I had gone to Bangladesh, I came back and instead went into further education to do a master's in tropical veterinary medicine at Edinburgh, and then a PhD at the University of Berlin. But my actual time as a PhD, the reason I chose to go there was that at the time there was quite a few, well, not too many, but there were some PhD opportunities for further studies. But many of them were based in Europe, and they were like working with calf diarrhea in farms in Scotland and things like that. And this was one of the few opportunities to actually do your field work abroad, which is what I wanted to do. And so I spent another nearly 3 years, 2.5 years, this time in Francophone West Africa, working on trypanosomosis, which is the single most important disease of cattle in Africa, and looking especially at drug resistance to trypanosides. And of course, drug resistance has become a very big One Health issue subsequently. And again, I think that was where I did my apprenticeship in learning about research, learning about science. I had done a little during my master's, but it was in doing a PhD that you really do learn how to become a researcher and how to apply some of these things. And I also learned to speak French extremely badly and with a strong West African accent, which has provided a great source of amusement to French colleagues ever since. So that was also another 2.5 years well spent. And after that, to take us to the 5th journey, so as you can see, I started in farmlands in Ireland, and I went to farms in Lancashire, dairy farms in Lancashire, to rice farms in Bangladesh, back to cattle in West Africa, and then to food safety. And so after having spent all those times in beautiful places, I was suddenly, thanks to my bosses at ILRI and there they sit, John McDermott and Tom Randolph. Instead of being out, in the green fields looking after the animals I loved, I was up at 2 o'clock in the morning to go to abattoirs and watch cattle being killed without any, with the benefit of any humane devices, and then following these cattle as they were being transported around on motorbikes to being sold in traditional markets with a thick swarm of flies generally around them. At the time, 2 of us started at ILRI, another colleague, Esther Schelling, who some of you may know. She's worked with Jakob Zinstag at the Swiss TPH, and they did some really foundational work in One Health. And so John and Tom recruited us, Esther to work on zoonosis, and me to work on food safety. And I really spent the first year in resenting her for getting all of the exciting work to be, there you are with wild animals and what's jumping from the panthers to the cattle and all of the exciting, sexy stuff, while I was looking at food safety. I mean, who looks at food safety? That's not for vets, that's for, I don't know, technologists or somebody. But after about a year or two, I suddenly started to realize that actually food safety was incredibly important and incredibly interesting, and a place where veterinarians and economists and sociologists and gender specialists and environment scientists not only could but were needed to contribute to solve this problem. And yes, so since then, since 2006, I've been working first at ILRI. Since 2020, I've also been working at the Natural Resources Institute in Greenwich, but continuing to work half my time in ILRI, and mainly on food safety in informal markets. So, why work on foodborne disease? I think many people still don't really appreciate how important an issue this is. Food security, of course, people are very aware about. Nutrition security has come in as something which people are talking about increasingly over the past 10 or 15 years, realizing the importance of stunting, for example, in children. But without food safety, there is no food security. And it's only in the last maybe decade that we've started to realize the importance of foodborne disease. A landmark study was produced by the World Health Organization, which developed the first estimate of the health burden in terms of sickness and death, something we call disability-adjusted life years, which is a composite measure which allows you to compare different diseases. Diseases which cause maybe a lot of sickness and not very much death, or a little bit amount of death, but not very much sickness. So we need a common metric to put all of these, compare all of these, and disability-adjusted life years are this yardstick. And this assessment found that the burden of foodborne disease was comparable in the same ballpark as the burden due to malaria, or to HIV/AIDS, or to tuberculosis. And these are the diseases which we call the big three. And there are hundreds of millions of dollars every year spent on trying to control the big three. And they have been very successful. If you look at the robe at malaria, if you look at the dots for TB, these investments, again, they really have paid off. They show that development money, often foundation money, makes a difference, saves lives. But nobody has been investing in food safety. And yet food safety has a health burden comparable to the big three. So I think when this data came out, and it was only released in 2016, so it still really hasn't, it's still not widely known, but certainly the more evidence-oriented donors and perhaps the more evidence-oriented foundations and philanthropies then did start to think, well, maybe food safety is something we need to pay a bit more attention to. And even more recently, in fact, I worked with the World Bank with Steve Jaffe to produce another study on the economic burden of foodborne disease, and it's over $100 billion a year. in low and middle income countries, costing low and middle income countries over $100 billion a year. I did another study with the Global Food Safety Partnership, and the investments in Africa in food safety have been $40 million a year. Africa is the continent which has got the highest intensity of foodborne disease. So you're talking $100 billion a year cost and $40 million a year investment. We're not going to solve it with that level of effort. So what have we, and another of the findings, and this is the area where I've been working mostly, and I would say that at ILRI we were one of the very few, probably for many years, almost the only group to be working in this particular area, the messy middle of informal markets. There has been, what limited work there has been, tends to have been on the farm, or in the household, working with consumers to try and change their practices, working with farmers to try and change what they do on the farm. But there had been very little research, very little efforts or investments in the markets where poor people sell their food and poor people buy their food, and where, according to our best estimates, probably 80 to 90% of that global health burden of foodborne disease is directly attributable to risky foods, to animal source foods and fresh produce sold in the informal, wet or traditional markets of low and middle income countries. Talking here about the burden of foodborne disease in terms of illnesses caused, another fairly under-known fact or little known fact is that only about half of this health burden is due to what we typically associate with foodborne disease. That is things like vomiting, diarrhea, constipation. A full 50% of the burden is due to things like death, renal failure, epilepsy, arthritis, paralysis, abortion, blindness, all diseases which caused by food. They are more rare, but because they are more serious, going back to our yardstick, once you convert them into disability-adjusted life years, these diseases like the pig tapeworm, my colleague Kate has worked a lot on this particularly horrible disease, which is a major cause of epilepsy in pig-owning communities in low and middle income countries. I was going to show a picture, but Swanee asked me not to, of a person's brain when they have been infected with pig tapeworm, and it looks like a mozzarella cheese. So these are diseases you do not want to have, and we get them from food. So informal markets have a major role in food security and food safety. And another important finding, another thing, it seems like a lot of my research has been trying to tell people things which are complicated or which they don't really want to hear. So another of them is, okay, we're just getting our head around how really big is the problem of foodborne disease and how much of it comes from these informal markets. But wait, you know, the answer is not to rush out and close down these markets or to all shop in supermarkets, the supermarketization as it's sometimes called. And we've even seen a bit more of this messaging with COVID, because when we talk about, it's not just, of course, foodborne disease, it's also emerging diseases which are associated with wet markets. There is still debate on exactly where COVID came from, but certainly wet markets have been implicated, and wet markets are informal slaughter. HIV/AIDS almost certainly spilled over as a result of slaughtering non-human primates from food. Ebola almost certainly spilled over from killing bats for food. So we know that these informal food systems, things you don't buy in the supermarkets, not only kill and sicken people, they also play a major role in the emergence of new diseases. But the answer is not to get rid of them, because these markets are also incredibly important for livelihoods, for nutrition security, for women. Women often dominate buying and selling in these markets. For culture, for psychosocial benefits. The wet markets in Asia, it's often where people go for a sense of community, where they shop every day, not even because they have to, but because they want to get outside their houses, meet people, buy the traditional food they love and they had when they're children. And all of these, some are monetary benefits, some are hard to monetarize, but all of these benefits people derive from informal food systems. So we don't want to get rid of them. We want to de-risk them. We want to make them better. And I would say in the first years, from maybe 2000 to 2016, the teams, the people I was working with, we were mainly researching the nature of the problem, how big it was, the risk factors, the drivers, but increasingly we've been focusing on the solutions, what we can do about it. You know, how can we make these markets better? Not get rid of them, but make them better. And what we find when we go to these markets, and here is another key concept, the difference between hazard and risk. A hazard is anything that can cause harm. A risk is a measure, a combination of two things, the harm caused and the probability of it occurring. So if you like, an electric cord is a hazard, but if you trip over that cord and break your leg, or if you stick your finger in the socket, that's a risk. And what we find is almost everywhere in the world, food safety is managed by people thinking about hazards and worrying about hazards and not understanding risks or not paying attention to risks. And yet, hazards and risks are not synonymous. Hazards can be very high, but risks can be very low. One of our first work was in the milk markets of Kenya. And this milk was full of brucellosis and E. coli and salmonella and listeria and whatever you like to look at. But the risk was extremely low. Why? Because pretty much everyone boiled the milk before they drank it. And yet, the policy and the regulation was saying that all milk had to be pasteurized, which was basically forcing people out of a highly profitable sector in the interests of big business and with no public health benefits. And once we were able to shift the thinking away from hazard towards risk, we were able to come up with solutions for informal markets. These are just some of the surveys I've conducted in different countries, and as you can see, pretty much everywhere we go, the hazards are pretty high, but the risks are not necessarily. Sometimes they are, sometimes they aren't. And we use a tool called risk assessment, which allows us to move from hazard to look at risks and to find out which are the things we should care about and which are the things which we maybe are investing a lot of scarce research and development money into, but is actually responsible for a very small burden of health. And I would say that, you know, for many years, for the past 10 years, I was working under a project which my colleague John McDermott led, the CRP for Agriculture for Nutrition and Health. And this was one of our biggest challenges and maybe one of our biggest successes in helping thinking about prioritization. What are the big causes? What are the little causes? Why we should work on the big causes first and the tractable causes first, and then work on the small causes and the intractable causes next. And another colleague here, Teresa, who I'm working with, we are now in a major endeavor to try and come up with the first global assessment of the burden of animal disease, the global burden of animal disease. The global burden of human disease revolutionized everything. That changed everything. And maybe we will be able to do the same for animal disease. Another of our findings, another counterintuitive finding, and sometimes it's the counterintuitive findings which are the most important. I mean, it's one thing to tell everybody to wash your hands after you've been to the toilet and before you handle food. I mean, that's important, but sometimes it's the counterintuitive findings, the things which people say, that can't be true, and then they think about it and look at it and they realize, oh, maybe it is true. And that's what causes more change than repeating the messages which are important, but which are more obvious. So one thing we found in several places is that these informal markets, which are where the poor buy and sell their food, and where most people get their foodborne illnesses, they're not necessarily less safe than the formal markets. Now, if you look at the formal markets in rich countries, they are pretty safe. If you go into a supermarket in Canada or Australia or Ireland, you can be pretty sure that the food is of, yes, there are some problems, but it's of pretty good quality. And the same is, as you've seen, it is not true of traditional markets in Africa and Asia. But when you look at formal markets, at the supermarkets in Africa and Asia, they don't always meet the same standards. Often they don't have the same, their electricity supply goes on and off all the time. They don't have the same checks and balances. There's no traceability. They buy their food from the same wholesale markets. If somebody gets sick and dies after eating in a supermarket in Vietnam, they don't have phylogenetic surveys so they can trace it back to the farm which made them sick. And without that ability to sue supermarkets and to sue big business, I was saying how important big business is. But it's also very important to keep business in check, because business is driven by the bottom line. And without those checks and balances, legal systems, consumer advocacy, things which are very weak in developing countries, business is not always the friend of the health of the poor. So this is a study we did in Vietnam, and we found to everyone's surprise that the pork sold in the supermarket, that's in blue, 100% of it failed to meet standards. And the pork sold in the wet market, that's in purple, a lot of that did not meet standards, but the supermarket was worse. And the best of all was the food sold in the village, and that very short value chain between the village and the person selling, often outside their house. So when it comes to food safety in low and middle income countries, formal sector can be worse than the informal. And again, coming back to counterintuitive insights, risk misperceptions abound, and that is why research and evidence needs a place at the table, if we may say, at the food safety table. Because when I was first working overseas in research and development, I worked in community animal health and a lot in participatory processes, and we really tried to learn and teach the importance of participation, the importance of listening to people, the importance of not coming to villages or to communities thinking we know everything, or because we've been to university, we know more than you do. No, often the people who are living with the problems, living in the villages, they know more than the experts. But when it comes to food safety, people's perceptions are often poor guides of what really are the problems. And one of the reasons is that people still tend to fixate over hazards and not understand risks, which are a rather probabilistic, unnatural way of thinking about health. And so, for example, nearly everywhere we go, we ask people what their concerns are, what they worry about, and it tends to be chemicals, it tends to be pesticides, it tends to be drug residues, or even within food, there's something called toxins, aflatoxins, which have long been a sort of a preoccupation in many governments. And there's something about chemicals which tend to make people worry. And in fact, there's a whole science about the psychology of risk. A guy called Paul Slovic started this, and he found all sorts of funny things which influence how people think about risk. For example, if a risk happens to somebody famous, we consider it's more likely to happen to us. This is sometimes called the Kylie Minogue effect, who was a famous soap opera star many years ago. But she, at a relatively young age for a woman, got breast cancer. She was in her 30s. And in actual fact, very few women get breast cancer in their 30s. But when this happened, millions of young women went out to get checked. Perhaps not a bad thing, but because it happened to somebody famous, they suddenly felt it could happen to them. Another way which causes us to make mistakes about risk is if something is in our own control, we think it is, we downplay the risk. So for example, people feel less nervous about driving in a car than they do about being flown in a plane. And actually being flown in a plane is orders of magnitude safer than driving in a car. but we perceive it wrongly. Again, it's been proven over and over again that people feel, even of totally identical risks, if they're due to novel technologies, things like GMOs or food irradiation, people think they're much worse than they really are. And if they're due to familiar things like food spoiling or fermentation, people think they're much less risky than they are. So people are very poor judges of risk. And what we say in food safety is what people worry about and what makes them sick and kills them is not the same. And this is where research can come in and do the risk assessments and find out really what are the big important problems and what are the trivial ones. And over again, where we've done these studies, and here is an example from Vietnam, we find that the chemicals which everyone was worried about are not actually the problems. It is the salmonella, the norovirus, the pig tapeworm. Those are the ones. And I can see a few people who actually do work in food safety are nodding their head. And there are other people who are just looking surprised, saying, really? It's not the chemicals? They're not turning the frogs gay? And again, when we try to make things better, we can sometimes make things worse. I've just come back. Before I was in beautiful, quiet Guelph, I was in southern Nigeria, which is not just so quiet and calm, and this is one of the biggest abattoirs, which was put in. You can see the concrete infrastructure. It was put in to improve food safety. And when it was put in, it was a nice modern abattoir with meat being moved along from clean to dirty along an overhead system. But this was it 20 years later. And we very often see in developing countries that there is money to build things, but there isn't money to maintain them. And we very often see that the best is the enemy of the good, so that people come with Rolls-Royce solutions to villages which really need bicycle solutions. And this abattoir resulted in much unsafer food than if you had stuck with the slaughter slabs, which was the traditional way of killing. You know, a little place as big as what I'm standing here kills maybe 1 or 2 animals a day, much safer than bringing in hundreds of animals, hundreds of people into this Dante-esque structure. So, ending on a good note, I've shown you some pictures, and I haven't even shown the worst because I didn't know quite who the audience was, and I didn't want anyone running out, or there was a lunch being served, so it would look very bad if no one could eat it. But I wanted to add on a positive note that although there are huge problems, a health burden as big as malaria, HIV, AIDS, or TB, and an economic cost, losses of more than $100 billion a year, there are solutions which are often simple, affordable, easy. So for example, in the abattoir I showed, we couldn't make it good, but we could make it better. And we did so by a very low-cost intervention of just training butchers. Training by itself, we know, is never enough. There must also be training plus motivation, training plus incentives, training plus a change in choice architecture, some reason for people to do things differently. In this case, it was a combination of peer pressure and also branding, the opportunity they had to market themselves as trained butchers who could offer a better service. For a cost of only $9 per butcher, about the same, less than you would pay for a pint of craft beer or fancy coffee, we were able to train butchers, provide them with basic equipment, and this, in terms of reduced cost of illness, saved $780 per butcher per year. And so in conclusion, because I can see that our time has come for the discussion, my take-home messages are, well, first, my thanks to Arrell, my thanks to Guelph, my thanks to everyone here and all the donors who have supported my work, all the colleagues who've worked with me, and especially the farmers, the vendors, the consumers who I have been working with and for the past 20 years. So my thanks and gratitude, and then some take-home messages from what I think are the most exciting things to come out of this research on foodborne disease and informal markets. Hazards are high, but risks can vary. Hazards are not risks. There are huge benefits of traditional food value chains, which must not be forgotten. The formal sector, the modern agro-industry, is not always better. What you worry about and what makes you sick and kills you is not the same. Control and command regulation rarely works in informal systems, but simple, appropriate, incentive-based solutions do exist and offer promise. Thank you for your attention.
Well, thank you so much. That was exciting, and it was also very motivating, and I look forward to our discussion and the questions. And I think at this moment, somebody's going to come and move the podium before we continue. Well, the first question is, what moments in your career have been most inspiring to you? That's a pretty fulsome question. My other question is, if you're working in a community, how do you affect change in a community? And perhaps you answered that question partially anyway in your presentation. So those are my two questions for you.
Yes, I mean, I think when things go well, it's always inspiring, and sometimes they do, not always. But sometimes they're more interesting when they don't go well. And there's a saying, you learn more out of one bad experience than out of 10 good ones. And so, yes, I think that has probably been more fruitful, but the most inspiring, and it is nice when things go well. And actually working in informal markets, because they are so underserved. As I said, I started working with farmers, but people who have never received training, who've never received help, who've never received attention, they do appreciate it so much that it's a good feeling. And how to affect change in communities? Well, again, I think the incentives are very important, and sometimes we forget about that there's too much emphasis on teaching, or just telling, you know, you should do this is what is correct, when really people must have a reason for doing things. And it isn't, sometimes we had one communication glitch in West Africa where we were saying we need to give the farmers incentives, and they were saying no, you can't give the farmers incentives, and then it turned out that they were, in their mind, when we were saying incentives, they thought it was money, and they were saying there are other incentives. It doesn't mean necessarily money. It can be social esteem, it can be status, it can be the feeling you're doing a good thing, but certainly people must have reasons to change. And I think the other thing is to find champions. There are always exceptional people in every situation, and if you can find them, or if they can find you, and if you can work with them, then they will be your agents of change.
Thank you. Are we time for the questions? Yes, time for the questions. So we do have one question online, and we'll start there. And then if you're in the audience and have a question, could you please put your hand up and somebody will bring you a microphone.
Waiting for, oh, perfect. So I'm going to ask the question from the online audience right now. And so we do have one question, and it asks, do you think the rapid expansion of farmers markets or informal markets in North America might cause increased risks to food safety? If so, what should we be doing to mitigate?
Yeah, I mean, that is a good question. I think, one, if you remember, I was sort of saying there was two messages. One was the risks of informal markets, which are definitely there. And the other is the huge benefits of informal markets in terms of nutrition security, fresh, wholesome, local food, psychosocial benefits, cutting out the middleman. So I think the rapid expansion of farmers' markets will also have those benefits in Canada. But yes, there are more risks for sure with any fresh food. And also, once you're moving from a kind of a more industrial process where everything can be controlled within very narrow limits into a more artisanal process with lots of people, and those risks have to be managed. They have to be assessed, and we have to take action to manage those risks. The good news is that we can, and I hope that we will. And again, but just quickly, because I've often, like the way one of the great successes of Africa is the way many people in my time in Africa jumped from having no way of communicating at a distance. They leapt over the landlines and went straight into mobile phones. Could the same thing happen with the way food is sold? That it may not have to go through a massive, agro-industrial, sometimes not very animal welfare friendly stage. Could we go straight from the informal markets to the farmers' markets? If we could do that in Africa, I think that might be a good thing.
So it's been so nice to get to know you the last couple of days, and thank you again for everything you're working on. I'm looking around and I see a couple of students who are really interested in agricultural technology. And Tyler Whale over there and I have been talking about agricultural technology for years. And we often think that new digital technologies and tools can help overcome all sorts of things, improve traceability and maintain control over supply chains and all that sort of stuff. Maybe lifting off of what you just said, Delia, what's the role of these sort of new, novel digital technologies in the wet markets and in the informal, small-scale, not so developed parts of the world?
Yes, I think some of these technologies, what did they say about a country which I will not name, the country of the future and always will be. So some of these technologies, there's a lot of promise to them, but they really are not now making a difference. For example, these rapid diagnostics, if anybody could go into an informal market and just hold up their mobile phone, which everybody has, and know immediately, is it safe or is it not safe? That would be a very powerful incentive for everybody to improve safety in formal markets. We're not there quite yet. We could be. Blockchain people talk about. Drones, I mean, their traceability, some of these RFID tags. A lot of promise, but not a lot in the here and now, and also a very big role for just appropriate technology. Things like meat thermometers, insecticide-treated netting, disinfectants. All of those are not being used and could be used. Thank you.
I think there's a question there.
And there's one
Hi
over
there.
there.
Thanks so much. Very interesting and so many things to take forward. I was wondering, I really liked what you said about how there's often money available to install something, to build something, but not necessarily to maintain. And I was wondering, in your research and the change that you've affected, what do you do to help ensure that that change is maintained over 10, 20 years or more?
It's a good question. I think one thing is to try and avoid technologies which are inherently very complicated and expensive to maintain. You saw an example in those abattoirs. I mean, there are smaller, simpler systems. At the moment, we're looking at the use of, say, mobile abattoirs in Uganda, which is something which could be more sustainable simply because there's fewer things that can go wrong. It's the same with diagnostics. During the time of avian influenza, we went round so many laboratories where they had got all of these PCRs and ELISAs, but they didn't have the reagents to run them. So they had all of this massively expensive machinery just becoming obsolete day by day and never used for anything. Now, in those cases, I would have said that training people in basic laboratory techniques, how to do cultures, how to do antimicrobial susceptibility with discs, These sorts of skills and technologies are more likely to be sustainable simply because less can go wrong and they can be managed in an easy way. But the other thing is creating a demand. So if there is no really demand or willingness to pay for PCR tests, then that's not going to be sustained. But if you can get vendors in markets or market authorities who are willing to pay $10 a month to test the water to see, and people care about the safety of their food, the safety of their water, and then if you can create that demand, then the supply will follow the demand. Too often we have built the supply assuming that the demand will follow. I think if you start with the demand, then the supply will follow the demand.
Thank you.
Hi, Delia. Thanks very much. Filled with amazing information and such huge problems to tackle. I don't want to ask you to describe the ideal situation or the ideal budget, but if you could build something that would best address the good enough situation in developing markets, especially in the wake of a pandemic, where I think the developed world now has a bit more of an appreciation for One Health, or at least zoonotic transfer. What might it look like? Who do you have to motivate on our side of the ocean, I suppose, to start to address these 100 billion, 40 million kind of gaps that you identified? And your slide about the men and women, the processing and the growing, I found that very interesting. If you were to target a group, we often hear so much about training women. That is perhaps the most important thing, most often the handlers and the preparers of food. Does that factor into that equation, or just whatever comments you have?
Yes, no, they're good questions. I mean, a lot of markets, they do need prerequisites, what we call, sort of just basic infrastructure. So it's very hard to do things when there is no running water or, not even the basics. But increasingly, especially in Southeast Asia, South Asia, that is being financed by governments. Decentralization, it hasn't helped disease control, but it has helped getting resources closer to some of these, county level and local authorities. So infrastructure, certain basics of infrastructure need to be there, but what has been neglected, and things which are neglected are often areas which are then more promising for external help, is the whole soft skills which need to go with the infrastructure. So for example, we evaluated a $60 million project in World Bank where about $40 million had come from the government of Vietnam, and we found that, it was basically an upgrading of infrastructure, and we found that in some of the upgraded infrastructure, food was no safer, and in others it was less safe. And the reason was they had put in the infrastructure, but they had paid no attention to the soft skills. So people had got metallic cutting surfaces, which are very easy to keep clean, but because they didn't like the cutting feel of these, they were using cardboard on top of the metal, which is an ideal medium for bacterial growth, more so than the wood which they had been using before the wood was upgraded to be replaced by metal. So I think more emphasis is needed on the soft skills, and I would say there's three things there. First is training, just sort of basic training, and these are low-hanging fruit because many of the market vendors have never got any training. We've been training farmers for decades. There's a lot more needs to be done in training farmers, but people have been doing it. Vendors have never been trained. Another is culture. And training doesn't always go hand in hand with culture, but in the food industry, we talk a lot about a food safety culture, which means changing the way people think, their mindsets. And again, there are ways to do this, which go beyond training. And then the motivation. What are the reasons why people should change their behavior? What are the incentives? What are the rewards? What is the choice architecture which makes it more easy to do good things than bad things? Even if it's just painting dirty areas red and clean areas blue, changing this architecture. And as you said, women, if vendors have been very neglected when it comes to training. The most neglected have been the women, because anywhere where there's anything for free, be it training or inputs, the men are usually the first in the line to get it. And yet it's the women who are the ones doing most of the selling and most of the food processing. And it's also, now there have been many studies in rich countries which show that women are more concerned about food safety than men, and that they also have, that they invest more in food safety than men. Not much has been done in developing world, but we did one study in Nigeria which showed that men and women operating in exactly the same markets, the men had more education and they had more resources, but the food being sold by the women was significantly safer and significantly less contaminated. And we didn't explore it too deeply, but we think it could be just because women they're used to handling food, to, looking after children, that they just vary kind of because of the way they things they have to do, in the way they approach food and handle food. And this is an advantage they have, which is not being capitalized or monetized. They're selling safer food, but they're not getting rewarded for doing so. So maybe that's something which could be done. But yes, training and allowing women to use their natural advantages in this area to improve their livelihoods.
Do you have a quick comment on a budget that would be suitable to deal with a $100 billion problem, as you mentioned?
Yes, well, a lot of these training interventions, they're not actually, I think evidence is one thing too, because you need to know where, it takes us back to prioritization. We spend a lot of time, even in food safety, looking at things which maybe are not very important. So there needs to be some evidence generation on what are the big problems, what are the tractable problems, what are the risk factors. If you can only do 5 things, what is it? Is it potable water? Is it training? Is it metal cutting surfaces? So there needs to be some, not just going by common sense, but putting a basis of evidence. And unfortunately, evidence does cost some money. Not huge amounts of money. We have student projects, master's projects, which generate enough evidence to do something in a market, in a given context, for $5,000 to $15,000. Infrastructure is expensive. It's very expensive. To upgrade a market which would supply a capital city would cost $500,000, but that would feed maybe 5 million people. So is $500,000 too much to feed 5 million people? The thing about it is it's flexible, but certainly if you want to solve $100 million problems, which has a health burden comparable to malaria, I would say the donor community has to be thinking of spending hundreds of millions of dollars a year to do that.
Yes. Go ahead. Oh, no. If you have a question that you didn't get to ask.
Or answer, please.
And answer. Please come to chat with Delia after we wrap, because I think there was one more person who had their hand up. So sorry about that. But it is noon. I'm surprised the time went fast. Delia, thank you so much. I don't know about the rest of you, but I'm really excited about opportunities to work in wet markets, and I hear your enthusiasm for serving a group of people that haven't been served, and there is big demand, back to the question about the dollar value. And I think you also shared with us the importance of maintaining the wet markets, because they have such an important impact on both the source of food, but also the source of income and the social structure of the communities where you work. So again, thank you so much for sharing. I want to say thank you so much to the Arrell Food Institute for today. And I meant to say thank you to the One Health Institute, but frankly, I'm not quite sure why. But thank you to the One Health Institute as well. I'll probably be corrected afterwards. And one more time, I want to congratulate you for receiving the Arrell Global Food Innovation Award for Research. Thank you, Delia. And I was supposed to remind people they can stay for lunch. Thank you.